A couple of other things to think about when you are thinking about the nurse's role with health promotion. Patient education provides a foundational role and provides competency in the professional nursing practice. So, patient education is going to be an expected component of all healthcare and in all settings. So, it's applicable to every area of health promotion that we are talking about. It requires planning and is determined by what teaching methods we are going to use, what our patient is able to understand, communication, those types of things. So it's definitely influenced by learning the domain used to achieve the outcome. We also, as nurses, want to encourage optimization of health. We ourselves want to promote and be good pictures of health, so to speak. So we want to maintain a high level of wellness in ourselves as well as preventing illness. And so it's practice what we preach, I guess, in essence. So we need to have a motivation to incorporate health promotion strategies into our own lifestyles. When you are getting ready to prepare your health promotion education project, take a look at the health promotion models that are on table 41 of your concept book. And the models that are listed out on there are health promotion, trans-theoretical, the theory of reasoned actions and planned behavior, social cognitive theory, and health belief model. So we discussed those a little bit in class, but take a few minutes and read about each one of those. The health belief models, most health promotion models really focus on individuals, and they're going to share the same themes. So sharing things such as cognition and decision-making skills. What is the motivation? Think about their behavior. What type of environment are they living in? So really we need to have a belief that illness can be avoided and that taking action will reduce the risks of illness. And the individual must also believe that they are capable of making those necessary changes. So we see those being really common themes when we think about the different health promotion models. When you talk about physical fitness and exercise, our bodies are made to move. They're not made to be stagnant and sitting in the same position and the same spot day in and day out. So it's essential to maintain optimal physical health and psychological health. With your nutrition screenings, these need to be part of that comprehensive health assessment. But when you're doing those screenings, remember it's important to respect patients' food preferences, and sometimes food does provide meaning in different cultures. So being aware of what those beliefs are and what those cultural practices are going to be part of cultural diversity, culturally sensitive care, and things that we need to consider when we are getting ready to promote good nutrition. So always assessing those rituals and customs. A great place to find information is choosemyplate.gov, and we can also see that there's lots of education for our patients there. With consumer education, it's going to be focused to each patient, definitely very individualized and not a one-size-fits-all learning and teaching atmosphere. We talk a lot about Maslow's hierarchy of needs, and in order to progress on to the next level, the patient has to have met that bottom or that lower level first. So when you're thinking about that, with the psychological, the security, the social, the ego, self-actualization, how do those things relate to our patient's motivation to learn? If they're surrounded by people that don't want to learn, how effective is it going to be? So we need to think about, their educational level, their literacy level. What kind of support do they have? Are they going to make it to support meetings? What resources are available? Specific developmental levels. And then, as always, thinking about the culture and what types of culture differences might make a difference in our teaching and learning. When you think about the National Healthcare Agenda, Healthy People 2020, looking at that, you need to consider the differences in the incidence of healthcare problems among minorities, racial, and ethnic groups. So Healthy People 2020 really is based with a health promotion initiatives that reflects assessment of major risks to health and wellness. So it's those goals will change as the public's priorities change. The emerging issues related to the United States health right now are preparedness and prevention. So being prepared for those catastrophic events like 9/11 and terrorist attacks, things like that. And then on the other side of that is, preventative medicine and taking care of those vulnerable populations that are more likely to develop health-related problems and experience worse outcomes. And people that are in that most vulnerable population are people with low socioeconomic statuses, persons who are members of ethnic and racial minorities. So being cognizant of those types of things. The U.S. Department of Health and Human Services really aims to produce a shift and implement new strategies where we're focusing on the goal to maintain optimal health and quality for life for people with multiple chronic conditions. We also are seeing an increased incidence of introducing palliative care early into the management of chronic diseases. So I'm not saying hospice care. As we will discuss in class, hospice care is really those last 6 months of a person's life, where palliative care can be started much earlier in the disease process, but trying to help people figure out how to make the most of the time that they have left. So it's really not geared toward longevity. It's geared toward what you have left and how can we make it better. So supporting health promotion and illness prevention is really the focus of insurance companies, and the idea is also there to help maintain cost with those insurance companies, but it's also to help provide quality, safe care as we move forward. With patient education, things with patient educations, you need to think about formal and informal groups, self-directed. What types of things can we do to enhance our patients' education? So think about the cognitive domain and increasing our patients' basic knowledge. The psychomotor domain, developing or improving a skill. So teaching that newly insulin-dependent diabetic how to perform their blood glucoses, how to administer themselves insulin, drawing up insulin. So it's helping, using those hands-on approach. The affective domain is changing or helping influence changes in our patients' attitudes. So what can we do to help them have a better attitude about their illness? And every time you're getting ready to do or perform patient education, you need to take some time to think about it and plan it, because you know the patient and you are the one that will determine the appropriateness of the education that you're providing. Your plan should be focused to meet learning outcomes, so it should be goal-oriented. And the end result should be that we have a change in behavior, a change in attitude, or an increase in knowledge, so that our patients are motivated to learn and they want to learn and they seek that learning as an opportunity to help take care of themselves. So in class, we will spend a little bit of time discussing everyday learning topics, and we will also spend time thinking about health-related topics and planning a teaching opportunity around healthcare related topics. If you have any questions, please don't hesitate to bring them to class. Send me an email and I will be more than happy to talk to you about them. Thanks for listening.